Good evening, ladies and gentlemen, and thank you all for joining us this evening for this How To Academy event. Tonight we are joined by Dr. Aseem Malhotra. He is a leading NHS-trained cardiologist and a pioneer of lifestyle medicine. He has been at the forefront of citing the health conditions which make us vulnerable to the worst effects of COVID-19. In this live-streamed event, Dr. Malhotra will be exploring the ideas from his new book, The 21-Day Immunity Plan, showing us how to start the journey to a healthier and longer life. The talk will last approximately 40 minutes, and then Dr. Malhotra will be taking Q&A. So please do put any questions you may have in the Q&A function at the bottom of your screen. But let's hand over straight to you, Dr. Malhotra. Thank you.
Thank you, Laura, and thank you to everybody joining in on this bank holiday Sunday evening. I hear we've got 350 or so people, so that's really great, and I hope that the next 45 minutes you find my talk interesting and enlightening and hopefully empowering, so that we can collectively do something positive when it comes to health, our own health, and the people around us. So I'm just going to share my screen now. Hopefully this is all working. Great, excellent. So a little bit of background about me. I've worked in the NHS for almost 2 decades. I originally trained as an interventional cardiologist, and a few years ago I decided to shift my focus away from intervention to prevention, where I think there is a much greater need in managing a lot of the chronic conditions that are affecting our National Health Service, increasing stress on the system. I also have a visiting professorship in evidence-based medicine at the Bahiana School of Medicine and Public Health in Brazil, and I'm a trustee of the independent health think tank, the King's Fund. So this has really been dominating the world, our minds, in the last several months. Very briefly, this virus that is affects the respiratory tract predominantly when people get quite unwell with it. Seems to have rooted itself or started in Wuhan in China, thought to come from a wild animal market, and very quickly then has spread around the globe. And when it came to the UK, we were alerted about this being a problem, that's something we needed to really address by the Prime Minister in March. And the original reasons for having what ultimately turned out to be a lockdown, extreme social distancing measure, was for the primary purpose of protecting the NHS, which was already, for reasons I'm going to go into shortly, already very overstretched. So the primary purpose was to protect the NHS from becoming overwhelmed. And the Prime Minister spoke about this in March. And up to that point, I was looking at the data that was coming out, certainly from China and Italy, who, the countries that had already been quite adversely affected by coronavirus, in the preceding weeks to the UK being hit with it. And it was quite clear at that point that most of the people that were suffering the complications of coronavirus, and up to date, there's approximately about 500,000 people around the world that have died, unfortunately, from this. In the UK, as you know, there's well over 40,000 people that have appeared to have succumbed to the virus as well in terms of fatalities. But what was clear from my perspective, looking at the data at that point in March and looking at research that was coming out, is that it all seemed to be linked, these complications seemed to be linked to age, and more specifically chronic conditions that develop with age, but even people who are younger. In particular, we look at conditions like type 2 diabetes, high blood pressure, heart disease, and of course, obesity. So having looked at that, I wrote an article initially in the Sunday Express newspaper, and I went on Sky News. I was invited to speak on Sky News. And the reason that I went on there was really to highlight that something that wasn't being discussed in the mainstream media and was being missed, which was the fact that these conditions were associated with something called the metabolic syndrome, which basically is all linked to type 2 diabetes, high blood pressure, etc., and obesity. But the really strong point I made, beyond what we were being advised to do in terms of social distancing and hand washing, is that what we should be telling the British public at this point is that they need to change their lifestyle. And the reason I said that is that research has already been, widely available and been, accumulating over the last few years, that changes in diet in particular could very rapidly reduce the risk and even reverse many of these risk factors associated with COVID-19 complications. So that was the main message that I put out at the end of March, early April on Sky, saying the elephant in the room is that this is a condition, complications of which are related to obesity and excess body fat. And we need to really put this at the forefront of the discussion in the mainstream, so that during this lockdown period, people could have the opportunity to try and think about their lifestyles and hopefully protect them from complications of coronavirus itself. Unfortunately, the Prime Minister, only a couple of weeks after that, he was admitted to hospital. And as everybody knows, it was a very sort of concerning, disturbing time for the country, because he got quite sick. For me personally, one of the first things I observed as a doctor, and this is one of the first things we learn when it comes to diagnosis, we look at patient's appearance, we try and pick up clues to what could be wrong. It was quite clear that Boris, had excess weight. The data had already started coming through that obesity was linked to complications. And of course, the people around him, his colleagues, the Chief Medical Officer, the Secretary for Health and Social Care, Matt Hancock, the Chief Executive of NHS England, Simon Stevens, had all also got the virus around the same time. I suspect maybe, they were obviously all meeting, they may have all spread it, it may have come from the same source. But the point I'm making is that they were, certainly from terms of observation, seemed to be a lot slimmer than the Prime Minister and didn't seem to get particularly unwell, but he did. So let's just take a step back. We'll come back to that shortly, but let's take a step back and try and understand what's going on. Well, the literature, there is quite a lot of literature on this, even prior to COVID, linked to flu, linked to SARS, the original SARS infection, is that essentially excess body fat causes a low-grade chronic inflammatory state. And what this means is that when we are afflicted by any particular infection and viruses, the immune system is dysregulated. It doesn't respond appropriately. First and foremost, in terms of the initial infection, we call the T cell response, which is impaired. But then because of this chronic inflammatory state, there is then an exaggerated immune response once the lungs are affected. And as one of the complications of COVID-19 for people who are most adversely affected is something called ARDS, or acute respiratory distress syndrome, where there is an exaggerated inflammation in the lungs and edema develops, fluid leaks because of that exaggerated immune response, which is linked to obesity and excess body fat. So this all comes together, and we call it meta-inflammation, if you like. But really, in summary, for everybody who's listening to this at the moment, I think the bottom line in very basic terms is that, poor metabolic health means poor immune health. And I will define metabolic health shortly, so don't worry, I'll come on to that in a minute in terms of how people can understand what that is. But basically, this is something that also develops with aging. So as you get older, the immune system does tend to reduce in its robustness, and there seems to be more chronic inflammation. But this is not completely, it's not something that is inevitable, in the sense that you can still do something to mitigate that with age, in terms of declining muscle mass, activity levels, eating enough protein, and we do tend to develop more visceral fat. The body fat percentage tends to increase over time with age as well. And that's why the biggest risk factor for death from COVID-19 was age. 80% of the people that died were over 65. Compared to people who are under 65, there's a 23 times increased risk of death if you look at age alone. But actually, when you looked at the data when it comes from Italy or China, the overwhelming majority of people who suffered had at least one underlying chronic condition. And you look, this is some data from one hospital in the United States, in New York, that basically looked at, what were the main comorbidities in people that died. And you see there, 88% had more than one comorbidity. Only 6.1% of people who were hospitalized didn't have any comorbidities. And again, you look here in Louisiana, another part of the United States, those conditions were, diabetes, type 1, type 2, obesity, kidney disease, cardiac disease, etc. Now, if you go beyond type 2 diabetes, a very interesting study from China looked at glucose control. and found that those with type 2 diabetes who were admitted to hospital, who had poor glucose control, had a tenfold increased risk of death compared to those with better glucose control. So the bottom line again there is that, these viruses, infections do tend to thrive off high blood sugar. And this is, data that even goes back to, before COVID. If you look at pneumonia and chest infections, people with type 2 diabetes, for example, with poor glucose control, are several-fold more likely to visit their GP with respiratory infections and much more likely to develop pneumonia. And we know this in medicine. Intuitively, we know this as doctors. It's just about putting it together that, type 2 diabetes itself does increase the risk of complications from any infection, but in particular if glucose control is poor. So what's actually going on? What's at the root of all of this? Well, this is a slide. This is a graphic from a publication that I published with 2 cardiologists in the British Journal of Sports Medicine a few years ago, just trying to look at the change of paradigm in the understanding of heart disease, because actually the root cause of heart disease, the root underlying biopathological process that's going on is related to 2 things: insulin resistance and chronic inflammation. Exactly the same root cause for type 2 diabetes, probably responsible for about 50% of people developing high blood pressure. And the lifestyle factors that play into all of that are a poor diet basically, which is a diet which is high in refined carbohydrates and sugar. I'll come on to ultra processed food shortly. Being sedentary and having excessive stress and poor sleep. These are all factors that lead into chronic inflammation and insulin resistance together. So let's talk about metabolic health and metabolic syndrome. So metabolic health is best defined by looking at 5 particular risk factors, if you like. And to have optimal metabolic health, you want basically all of these levels to be within normal range. So blood pressure should be less than 120/80, or HbA1c, which is a marker of your average blood glucose, should be less than 5.7%. In fact, above 5.7% up to about 6.5 is what we call pre-diabetes. So a lot of people with pre-diabetes may not be getting identified who are suboptimal metabolic health. And then it's not obesity per se, it's waist circumference. So waist circumference, which is greater than 102 centimeters for a man and 88 centimeters for a woman if you're Caucasian, but for South Asians it's less. And blood triglycerides should be less than 1.7, and HDL cholesterol, so-called good cholesterol, should be greater than 1. Now, when you have any 3 of these as being abnormal, you have metabolic syndrome. And that in itself is associated with increased risk of heart attack, stroke, and death over about a 10-year period. So this is, and what's interesting is when you look at metabolic syndrome, in the people that are most risk of heart attack, stroke, and death in general over that decade are people with a normal body mass index. So this is a problem with the body mass index, which basically just looks at your, it's a measure, it's a very crude measure of your weight in kilograms divided by your height in meters squared. And what the problem with the body mass index, and if you have 1/30, then you're considered obese, is it doesn't take into consideration your body fat distribution, your muscle mass, and your ethnicity. And the ethnicity issue is really important because there's been a lot of, I think, confusion created around the fact that there's been a disproportionate effect on people from Black, Asian, and ethnic minority backgrounds from COVID. And it's all the biological reasons for that almost predominantly are because of metabolic health issues. So that people who come from, for example, from South Asian backgrounds, about 43% of those people who have a normal BMI are metabolically unhealthy. And then you go, and then around 38.5% in Hispanics, 32.2% in Chinese Americans. This is American data. African Americans, 31.1%, and about 21% in white. So it's still a very large proportion, even in Caucasians, of people who have a normal BMI will be metabolically unhealthy. And that's important because actually this is not something that's routinely assessed in modern medical practice. It's not something that general practitioners are doing. It's not something that's being managed in secondary care. As you well know, we treat single conditions primarily with pills. So blood pressure pills for blood pressure, type 2 diabetes. And these pills, as I highlight in the book, actually have a very marginal effect for the overwhelming majority of people. In fact, don't even prolong lifespan or prevent heart attack, stroke, or death. So that we're missing we're missing a trick here. We're missing something very important, that we're actually probably not highlighting many people at high risk. because who have metabolic syndrome and are not being managed. And therefore we're gonna, these are the people that were vulnerable to, complications from COVID-19. And once you correct for this, the data so far suggests that once this was corrected for these, then there is no increased risk. So there doesn't seem to be any genetic reason to say that people from, ethnic minority backgrounds were increased risk of death from COVID-19. It's just that genetically there is, we seem to develop conditions like type 2 diabetes and high blood pressure at lower levels of body fat. So there is some ethnic disparity there in terms of, compared to Caucasians, and it may also be for South Asians in particular. There tends to be lower muscle mass and lower cardiorespiratory fitness as well genetically. So the message should really be, let's identify these group of people and then let's institute the lifestyle changes that are going to help reverse these risk factors, which can happen very quickly within a very short space of time, within a few weeks. So when we look at excess body fat as an issue, as many of you know, the statistics on obesity per se, if you look at obesity, 60% of the adult population are overweight or obese in this country, and 1 in 3 children in the same category. Is very disturbing. But actually the bigger issue is being over fat. Essentially, how many people, what percentage of people have excess body fat that will put them at risk of all these conditions, such as stroke and heart disease, type 2 diabetes, gout, cancer, Alzheimer's disease. And this is what we really need to be talking about. This is a shift in the paradigm we need to be discussing. And this really is the excess body fat that seems to develop around the abdomen. It's estimated about 80% of people in Britain have excess body fat that's going to put them at risk. And in America, I think this is synonymous with metabolic health. About only 1 in 8 people are metabolically healthy. And this even applies to people who are young. So 1 in 4 people between the ages of 20 and 40. This is a really big problem that's being, is not being highlighted enough. And again, those markers I brought up earlier are very simple and safe. They're not expensive tests. Everybody can do it. What else you can do at home, before you go and see your GP and get all this checked, if you don't have it done already, there's actually another slightly a good rule of thumb with a tape measure. If you measure your waist circumference at the belly button, it should be less than half of your height. And this is actually quite a reliable marker to tell you whether you're at risk as well. Ideally, you want the other things checked, blood pressure, of course, and HbA1c and your triglycerides and HDL. But this is a reasonably good rule of thumb. So the data we've got now, if we look at COVID, just to try and give you some perspective on the risk. So if you're obese, if you have a BMI of over 30, being obese doubles the risk of being hospitalized and just slightly less than 2-fold risk of death. But metabolic syndrome is much worse. So if you have those 3 abnormalities I've mentioned before, at least any of those 3, then you've got almost a 5-fold risk of ending up in ICU and actually dying as well. Dying is about 3.5 risk, but in terms of getting very sick, about almost 5-fold. So what's driving all of this? Let's also cut through a lot of this confusion that's still existing at the moment. It's diet, predominantly diet. Poor diet in terms of illness now is responsible for more disease and death than physical inactivity and smoking and alcohol combined globally. And when we talk about poor diet, again, to try and cut through the confusion, the biggest issue really is ultra-processed food. So more than half of the consumption of calories in this country amongst adults is ultra-processed food, which is really quite shocking if you think about it, that how have we allowed this to happen? If you go back 40 or 50 years, there wasn't this anywhere close to this degree of consumption of these sorts of foods. It was traditional meat and 2 veg, and surprise, surprise, you look at, I look at photographs of people gathering on beaches, from the sort of 1960s and 70s. You didn't see anybody who's overweight. This is a food environment problem. So what is ultra-processed food? There is a very interesting, very helpful international classification. If you want a bit more detailed knowledge on it, you can look it up, called the NOVA, N-O-V-A. It's not an abbreviation, it's just called the NOVA classification. It came out of Brazil. And they will also show you all the evidence and studies that show that there's been at least 30 studies now, observational studies, showing that consumption of ultra-processed food is associated with many conditions: type 2 diabetes, heart disease, cancer, even independent of body mass index. So this is beyond just being the BMI. As I've said, it's more about metabolic health and excess body fat, but you can actually develop these conditions even if you have a normal BMI, if you're eating foods that are going to give you chronic inflammation. So a very simple rule of thumb, which is what I use with my patients when I try and advise them about one of the best things they can do is cut out ultra-processed food. If it comes out of a packet and it has 5 or more ingredients, usually with additives and preservatives, it's ultra-processed. And often these foods are high in starch and sugar and unhealthy oils. And the data is now evolving. We now have a very interesting randomized controlled trial published in America last year, which showed just over a period of 2 weeks that people who, once you had the same macronutrients and the same number of calories to start with, people who consumed ultra-processed food versus, minimally processed or whole foods consumed at least 500 calories more per day and end up gaining around 2 kilograms in weight compared to the just over a two-week period. So these foods are, heavily marketed and probably designed by the food industry to encourage overconsumption. They interfere with appetite and hormones that control appetite and encourage overconsumption. So this is really what we should be cutting. Now, this particular slide, I put this in there because this is something people probably wouldn't think was ultra-processed. People associate it with, junk food like crisps and chocolate bars and that kind of stuff. But this is so-called, healthy bread. This is brown bread that you get in the supermarket. This is an ultra-processed food. This should be avoided. This should not be eaten if you want to look after your health. This is a quote from Robert Lustig, my colleague in the United States, and just again to eloquently summarize it, is that ultra-processed food sets you up for inflammation. We have data showing even within weeks of consuming such types of foods, and fast food in particular, sugary drinks will raise markers of inflammation in the body just within weeks. The other issue is low quality carbohydrates. Now, many of these ultra-processed foods are going to be high in starch, and low quality carbohydrates are essentially foods that lack fiber, that when you eat them get rapidly converted to glucose in your bloodstream. And it's actually high glucose that raises insulin that over time is most likely the cause behind the increase in insulin resistance and many of these chronic conditions. It's not the only factor, but it's one of the major factors. And in particular, this is a slide that was kindly given to me by Dr. David Unwin, who's a general practitioner who's done really amazing work in his own practice, where he's managed to send, many of his patients, almost 50% of them have gone into remission from type 2 diabetes. Most of them had a much increased glucose control, and they've managed to come off insulin and reduce their medication load. I see the same thing. I've not gathered personal data, but I have many anecdotes of individual patients doing the same thing with the advice I give them. And this, again, happens very quickly. So this slide is just kind of something, this is this is something that he uses with his patients to help them understand the effect on blood glucose of different types of food. And this is a little bit old now, but at that point he's got more data now. I think he's got up to about 150 patients. But this is just to show that it's not just improving people's glucose control, in his clinical practice. These, when you cut out the refined carbohydrates, when you cut out the ultra-processed food, it improves all the other markers of the metabolic syndrome. It improves triglycerides, your HDL, waist circumference, blood pressure, and out beyond this, and I don't want to bore you with lots and lots of data, but there are several clinical studies that have been done that show that within 21 to 28 days, you can reverse metabolic syndrome in up to about 50% of people. So the reason the 21-day immunity plan was written, one of the reasons was to give people information to show that if you have metabolic syndrome, there is a very good chance that you can reverse it. You can certainly improve many of the risk factors, but actually come out of that definition of metabolic syndrome in about 50% of people. And many other people will improve those markers as well. So what's going on? Let's just take a step back. I've talked through a little bit of the biology here and the pathophysiology of it all, but what's actually going on is the fact that this problem, COVID, in tackling the obesity epidemic, is that this rooted in the food environment. It's become almost impossible to avoid these sorts of ultra-processed foods. Wherever you go, on the high street, this is where it is. And for me personally, and this is still a big issue, I think the biggest scandal is that we even allowed our hospitals to become a branding opportunity for the junk food industry. More than 75% of food purchased in hospitals is now ultra-processed and unhealthy. And therefore, it's no surprise, healthcare professionals are also vulnerable. More than 50% of NHS staff, doctors and nurses, are also overweight or obese. We would argue, I'm sure many more have probably are over fat and have got a suboptimal metabolic health. And if we're really going to make inroads in tackling this, we need to just take a step back and realize that we need to sort the food environment out. And this is Tom Friedman's Health Impact Pyramid, which highlights that changing the context, making the individual sort of the individual choice, a healthy choice for everybody, is going to have a much bigger impact than individual counseling or education. So, with this book, there is the science that people can take away, they can implement it themselves. But actually, if we're going to help the population, we need to think about how we're going to make that healthy choice, easy choice through regulations, which I'll come to a little bit later. And if you look at, we can learn from history from smoking. So, the biggest decline in cardiovascular death rates, the biggest impact on that happened over the last few decades because of reduction in tobacco consumption, which in the 60s was around 50 to 60% of adults were smoking. I mean, which is extraordinary when you think about it now, that most of the adult population, similar to the ultra-processed food, there's an analogy there, was smoking then, and now we've got it less than 20%. It's not perfect, but it's been a massive drop. And that only happened when we tackled the availability, the affordability, the acceptability of smoking cigarettes. So what does that mean? It means taxing cigarettes. That was responsible for the biggest decline in consumption. Public smoking bans, dissociating, tobacco from sport. I remember as a child growing up as an avid cricket fan, I used to watch Test match cricket, and it just would roll off the tongue. Benson and Hedges were the main sponsors. The problem is we've got this now with ultra-processed food and junk food. So it's very highly likely, very probable, if we institute the same sort of regulatory mechanisms, we would have a much bigger impact. We would almost certainly reverse the obesity epidemic, type 2 diabetes, the prevalence, and probably heart disease in a very short space of time. But despite this, I've been campaigning, many people have been talking about this obesity problem for many years. And on the background of COVID, one NHS trust decided, in fact, this is a hospital I used to work at, which had actually made good inroads in improving the hospital food environment, bizarrely, decided that they were going to put out a tweet endorsing and supporting Krispy Kreme donuts for donating, 1,500 donuts to this particular trust. And from my perspective, I don't like normally engaging with, I wouldn't consider myself a troll. I ignore trolling, but I thought at this point I had to speak out. And the reason I did this is because, organizations and even NHS England, Simon Stevens and his fellow, we'd published something in the Postgraduate Medical Journal, worked with the Academy of Medical Oncologists. The medical profession, even NHS England, had already come out and made statements and backed policies saying that we should remove junk food from hospitals. So what's going on here? I think the other thing to add in, we've talked about glucose control being really important for people who are going to be afflicted with COVID-19, with people with poor control, on admission to hospital, having worse outcomes. These sorts of foods are the worst sorts of foods for your blood glucose. So there is an argument to be said as well that actually this is the last thing, frontline NHS staff that are stressed out, that are managing people with COVID-19, this is not the types of food we should be promoting, encouraging. Now, are we saying we should ban it completely? Well, some people may make that argument, but actually, I think what's important is an acknowledgement that actually, when people are vulnerable to catching COVID, the worst things they could be eating, are high glycemic index carbohydrates. Because if they were to get it and their glucose control, if they were pre-diabetic, for example, was to go off, theoretically, I can't prove this, theoretically, this could actually put them at risk. And there is good data that shows that even independent, even in healthy people, high blood glucose on its own, at least temporarily, will double a clotting factor in the blood. So increasing the risk even of potentially of thrombosis. So this is it's just very ill thought out. And it was, for me, this was a marketing opportunity for Krispy Kreme donuts. I think they were using the NHS as a marketing opportunity. After this, there was a big news story around it, BMJ. I was involved in a discussion that was published in the BMJ about the pros and cons. I made the point that this isn't about attacking individuals. This isn't about fat shaming. This is about hospitals setting an example on healthy food. And also to realize that these sorts of companies are using the current crisis that was going on around the NHS as a branding opportunity for their products. And of course, one donut is not going to kill you. Let's be honest; it's unlikely to kill you. But one cigarette wouldn't kill you either. But we're not selling cigarettes in hospitals anymore. So why are we promoting this sort of stuff? And just to go back in time, he that does not remember history is bound to live through it again. That's a quote, a famous quote. Is that this was? around the 50s and 60s, when the first links between smoking and lung cancer were published in the British Medical Journal, that's when the awareness started to gather that there was a link between smoking and lung cancer. The tobacco industry actually launched a PR campaign where they used doctors to promote cigarettes. So you can go on YouTube, and if you go on YouTube and you Google and you stick in more doctors smoke camels, you'll be absolutely, I mean, it's pretty shocking. It's quite extraordinary. It basically shows doctors in their consulting rooms smoking cigarettes and talking about how, what their favorite cigarette is. So this is all, this is the same thing happening all over again. So just to come back to the issue about why I was particularly disturbed by that particular NHS trust, welcoming all these donuts for the staff. This is something that I published with Terence Stevenson, who at that time was the chair of the Academy of Medical Royal Colleges, arguably the most important doctor in the UK, representing all of the Royal Colleges, and Mahiben Maruthapu, who was Simon Stevens's fellow. So this was published, and there was a press release, with Simon Stevens' blessing. This was a few years ago. And really we wanted to make the point that this is such an important issue that hospitals set an example, is that we should be informing patients and the public how diet can improve health, and that's a responsibility for all healthcare workers who should lead by example. But of course, the lack of education, training, and access to information is still there. But there's also an argument to be made that if the healthcare workers themselves are not have suboptimal health, it will affect performance. We know there are more sick days because people who have poor physical and mental health. We also have some data suggest that organizations that have healthy workers perform better. So for me, I would argue, even from me following my own advice and changing even my diet, having been pretty awful at one stage of my career, I actually thought, if I'm working night shifts, I need to be on the best physical health I can be for this, not just for me, for the sake of my patients. For the sake of my patients. If I'm going to the cath lab in the middle of the night to operate on someone who's having a heart attack, do keyhole heart surgery, am I not responsible to make sure that I'm in the best physical state I can be so that I'm operating as best I can? I don't know why this isn't getting more attention. I think we need to think about that as well as healthcare professionals. Our patients deserve it. So what's going on? Well, this was published in BMJ Nutrition, and the major barrier still, why this is not being infiltrated, I think, one of the reasons why, there is trolling on Twitter still from doctors who are making fun of many people in this movement who are actually saying that we need to really just change diet, and diet can be very effective. Food has a role in healthcare. It should be part of prescription now. Is lack of knowledge, basically. The main issue is lack of knowledge. So this was a survey done of junior doctors and medical students, and revealed that overwhelming majority of doctors lack knowledge, confidence, and time. But the good news is that most of them actually, when they were surveyed, felt that patients would expect them to have knowledge, and felt that it was very important for them to. And just to give you some perspective, there was another study done a couple of years ago. Many of the members of the public who are listening to this may be shocked with what I'm about to tell you. Certainly people who are well informed on how diet affects health. A third of doctors in a study in the United States could not even identify an oily fish. A third of them, only a third of them could identify an oily fish. Not they couldn't, a third. So 2/3 could not identify an oily fish. So this is a level, it's very basic stuff. It's not rocket science. But this is the confidence. If you lack the knowledge, you lack the confidence. This is not something I was taught at medical school. It's something I had to learn myself. And it can take a little bit of time initially, but it is not difficult. We need to really make sure this is compulsory part of undergraduate and postgraduate medical education now, for it to be implemented, so that every doctor can be empowered to advise their patients according to diet. And what has modern medicine achieved? Well, it has done some great things. But as I put in the first chapter of the book, most of the increase in life expectancy, certainly that's happened in the last 150 years, we've added about 40 years to our life expectancy from about 1850 to now. And 32 of those years can be directly attributed, more than 32 of these can be directed to public health interventions. Only about 3.5 to 5 years is because of modern medicine. So I think there's a perception issue here. There's a perception issue amongst doctors, and there's a perception issue amongst the public about what modern medicine can do. And now we've got an over-medicated population. We've got people who are being managed with these chronic conditions, who are getting side effects. The pills themselves only have very marginal effects. And if we combine that with simultaneously not addressing lifestyle that can rapidly improve their health, we've got a problem. This is the problem we're facing. This is why we've got this, this is the major root cause behind this chronic disease epidemic. So, as part of my advocacy as a campaigner, I kept banging the drum after Sky News. I then wrote another article in European Scientist that was press released. I said, again, this was, and highlighted why Boris Johnson got unwell was likely because of his BMI, because he was actually obese, because he had a lot of excess body fat. He'd come out of hospital by that point. I was sensitive to all of that, and he'd recovered, thank God. And I thought this was an opportunity really just to mention this again, saying that we need to really just get the message about, he started off saying, stay at home, protect the NHS, save lives. Actually, another message should have been eat real food, protect the NHS and save lives. And I wrote an article in Telegraph newspaper, which was featured on the front page, which was, at the end of sort of moving towards the end of April, early May. And I was then asked to go on Good Morning Britain and BBC News. And I talked about this again. Finally, we were getting some mainstream coverage, better late than never. I wish we'd had this at the beginning of the pandemic. I really wish we had. I have no doubt many people's lives would have been saved if we had. In fact, a modeling study was done recently, suggested that almost half, 50% maybe, of the 40 to 50,000 people that succumbed and died from COVID-19 would have been saved if they had healthier lifestyles. Now, of course, you can argue this is a longer process and we need to sort the food environment, but certainly there was a chance many people would have saved, their lives would have been saved if they had implemented a lifestyle plan and been advised on this much earlier. So this became a news story. I did mention that, it's likely Boris Johnson got unwell because of his weight, or more sick because of his weight. And I also said that with the context of background knowledge that I had been, I'd previously worked as an advisor to London Food Board, somebody very senior there to me when he was mayor of London, when Boris was mayor of London. And a few years ago, they had expressed concern to me because I was the clinician as part of this, said, Aseem, I'm very concerned about Boris and his weight. He cycles everywhere, but I'm worried about what he's eating, and I think there's been an initiative now, which we'll come on to, about the issue of exercise. Exercise has great health benefits, but it's not very effective when it comes to weight loss. The primary focus should be diet. And when I said this on the mainstream news, it was then picked up as a news story in the Times the next day. And I thought, well, actually, I think maybe this would get through to the Prime Minister. I didn't feel that I'd said anything offensive. I was saying it as what I knew, my knowledge as a doctor, as a clinician, to highlight this. So hopefully we can get some impact. And interestingly, just after that, Matt Hancock, I was in touch with Matt Hancock, and he asked me to email him evidence linking obesity to COVID-19. So I'm just checking the time here that I'm not overrunning. No, we're fine. And I did actually write an email to him, and he acknowledged it and copied in the special advisors. It was just after this, and I suspect, and probably the Prime Minister himself, I'm sure, was involved and was aware of what was being discussed between me and Matt Hancock. But I basically said to Matt Hancock, two things. One, this is beyond BMI. This is about metabolic health. And I also said that we need to regulate here. We need to really regulate against the food industry. So I sent him that email around that time. And I was pleasantly surprised to see that this was in a front page news story in May, not long after that, that the Prime Minister had decided that he was going to now, think about interventions and regulations against the food industry as part of this package to tackle it. I'm not too sure whether the headline was an appropriate one. Launch war on fat. Dietary fat is not the problem. Excess body fat is. So maybe we're launching a war on excess body fat. But again, this is not an individual personal responsibility issue. This is more of a food environment issue. I then, my publisher, I was in the middle of writing another book, which I won't tell you too much about at the moment. That's going to come out next year. I've got to finish that. But my publisher, contacted me, said, listen, Aseem, you've been talking about this a lot. Can you write a book, and can we get it out in 6 weeks? To be short and precise, and give people a background understanding, as I have in the talk, about what's going on with COVID and immune system and metabolic health, and then what people can do about it. So I'm delighted this came out on, was released officially on Thursday. I did actually, in my own way, get some peer reviews. I sent it to various organizations and people, including dietitians, the British Dietetic Association, just to check they were happy with the wording that I was using about this. And people like Professor Carol Sikora, and many other doctors and clinicians around the world gave me very good feedback, which was encouraging, certainly, that what I'd written, was a strong argument and evidence-based. Grinda Chadha, who is a friend of mine, actually, she contacted me. We spoke during the COVID-19. She had type 2 diabetes and has been suffering with weight issues for a long time. And she asked me, what can be done for her. So I gave her some advice, exactly what's in the book, actually what she should be doing. And she's managed to significantly improve her glucose control, essentially, sent her type 2 diabetes into remission. And she did that within weeks, really, of being very strict with what she was eating, cutting out the ultra processed food, changing what she was cooking, cutting out the low quality carbohydrates, and felt great because of it as well. Now, Tom Watson, the deputy leader of the Labour Party, who kindly wrote the foreword, he had already followed similar dietary advice from my first book, The Piopi Diet, and had done very well from that. And he's been in remission from type 2 diabetes now for the last couple of years. The book itself, when it comes to the 21-day plan, there is some similarities in the dietary plan that from the Piopi Diet, my first book. And this is 3 people who, in Holland, a Dutch film company, wanted to do an experiment, N equals 3, just 3 people, just to see whether my claims were effective from the Piopi Diet. And this was a couple of years ago, and they filmed it in Holland and basically followed somebody with type 2 diabetes, a patient with blood pressure, and a lady with weight problems. And they were this is them hugging at the end of the 28 days, because they got all their results on camera live from their doctor, who was monitoring them. The chap with type 2 diabetes, who was in his 60s, about to go on insulin, who'd been type 2 for 15 years, sent it into remission. His glucose, blood glucose normalized, HbA1c normalized, extraordinary. I mean, even I didn't expect that within 28 days. And the other 2 people certainly include all the metabolic health markers. One of the other gentlemen managed to reduce the need for blood pressure pills. So that was how the Piopi Diet was. And this is really the other issue as well. So we've talked about the food environment, but the dietary guidelines themselves, I think, are a bit of an issue. This is a so-called Eat Well guide. You'll see it in hospitals. You see it in canteens. This is supposed to be representing what we should be eating, a balanced, so-called balanced diet. Now, a lot of this stuff is good and healthy. Whole fruit and vegetables, got no issue with that at all. And some of the tin stuff is fine, minimally processed food. But a lot of the plate, a third of it, is really made up of starchy carbohydrates. Now, and most of this, if you go into the supermarket, is going to be ultra-processed food. So you've got that issue. Then if you look in the bottom left corner here, you've got these crisps, sugary drinks, sorry, not sugary, crisps, chocolates, cakes, and there's this very vague advice on the plate: eat less often and in small amounts. What does that mean? That doesn't mean anything. It's a branding opportunity for the junk food industry. I'll tell you why it's a branding opportunity: because they're involved. Members of the ultra-processed food industry are involved in making up this guide, which is just doesn't make any sense to me. It's just nonsense. It shows as being commercial influence on that plate. Now, somebody who I'll not name on Public Health England, the previous Public Health England, and now being sort of disbanded and being changed to another organization, somebody extremely senior in a private conversation with me, when I asked them, why have we got ultra processed food on the plate? At least get rid of that stuff in the left corner. Why can you? And this person's response to me was, Aseem, you've got to understand, one of the biggest GDP contributors to the GDP of our economy, of the food industry. For me, that was just blatant admission that this so-called, what's supposed to be an independent healthy eating, is being influenced by the food industry. This is wrong. This is absolutely unethical. And the public and doctors deserve to know this. So I've been a very strong advocate for this for a while. For me, this is about highlighting injustices. This is about transparency. It's about openness. Before, just after the Piopi Diet was published, I was asked to speak in a hospital in Tameside, where I grew up. And essentially, the chief executive, it's in the Sunday Times, Public Health England, Duncan Selby, contacted, first of all, endorsees of the book, which include the chair of the Medical Royal Colleges, Andy Burnham, the mayor of Manchester, and asked them to dissociate themselves from the book when they'd already endorsed it, and also suggested to the chief executive of this hospital that they should stop me speaking. And this was then, it came out as a story. Tom Watson, came to my defense and basically said, which is something I think was fair, You know, he was surprised that a government agency responsible for helping us get healthy has tried to close down a respected cardiologist who just wants us to make people well. If they disagree with him, debate with him, don't silence him. PhD said their dietary advice, which Watson ignored to lose weight, is supported by the best scientific evidence. Well, you can make your own mind up about the scientific evidence behind that Eat Well guide. And you know, I'm just highlighting something here, which I'll close the loop in a second towards the end of the talk. But you know, when you're involved as someone like me and other people in this movement, really as an increasing local minority, when you threaten an industry, unless you're an advocate for a totally uncontroversial policy, as soon as your work threatens an ideological cabal or industry, you will be attacked, sometimes unrelentingly and viciously. And it's just part and parcel of what we do. But you know, we need to then tackle this together. There are people who stick their head above the parapet. They're much more vulnerable. If we do this together, we can make much bigger impact for everybody's health. And I just draw on something which I think, you know, I only came across a couple of years ago, which really made me reflect on what my role is, my duty as a doctor, but what we should all be doing. This is 7 Nolan principles, which is actually, you know, principles that people in public life, doctors, teachers, police officers, politicians should all be following. I think we should all think about this from a moral perspective. Are we engaging, are we acting with selflessness, objectivity, integrity, accountability, honesty, openness, and leadership? This is something that it came to me when, as a trustee of the King's Fund, an independent health think tank, this is something that we're supposed to all think about and adhere to. I don't think that anyone can really challenge it. These are noble principles. And part of leadership is actively promote those principles and be willing to challenge poor behavior wherever it occurs. Being able to challenge poor behavior wherever it occurs. Now, sadly, you know, my own mother, who was a GP for 25 years, she succumbed, she died of an infection. This is 18 months ago, well before COVID, in her spine. And her baseline health metabolic health was very poor. Unfortunately, she developed, you know, she'd become, by BMI terms, obese when she was in her 40s and 50s. She had a stroke because of high blood pressure. She got better from that, but then developed severe arthritis, had an autoimmune condition. And by the time she died, she was very frail. She got an infection in her spine. It was a horrible thing for us as a family to witness, for friends to witness. She was on very high doses of morphine for 4 weeks. And she wasn't able to fight this infection because she was so frail by this time. But it wasn't just the issue about her lifestyle that affected her health and ultimately resulted in premature death. It was the way she died. She suffered a heart attack in hospital. And because the NHS was already overstretched, her treatment was delayed. She was essentially gasping for breath for a good 2 hours before she could get given a drug called diuretics to get rid of that fluid. And because the registrar, who was too busy, was on call, and it wasn't, you know, this was a weekend. This wasn't even a weekend. This is during sort of normal working hours. So, you know, we're all now affected by this, and doctors are at the state, and the NHS is under so much stress because we haven't dealt with this wider determined chronic disease epidemic, mainly being driven by poor diet. And until we sort that out, we're not going to be able to relieve stress on the NHS. So just to finish up now, my 10 recommendations for policymakers are: we need to tax ultra-processed food. We need to use that money to make healthy food more affordable. All medical students and doctors need to have adequate training in nutrition and lifestyle medicine. That is completely, almost non-existent at the moment. We need to measure the right markers. We're missing a lot of people who are at risk, especially people from ethnic minority backgrounds. We need to measure metabolic markers and then act upon it. We need compulsory nutrition education and cooking skills introduced in all school curriculums. You know, we need to start from scratch here. We need to get this as a basic skill for everybody, so that half of the diet doesn't need to be ultra-processed food. People can have cooking skills. They need to be able to at least learn to cook. All hospital chief executives now need to be made accountable, for, as far as I'm concerned, for allowing the sale of the promotion of these foods. The medical colleges, the BMA, even NHS England have said that we really shouldn't be promoting or selling these foods on the hospital premises. So the chief executives need to cut these contracts with these companies that are, you know, the foods are essentially a metabolic poison. On a wider scale, we need to ban the sale of the advertising, of all ultra-processed food and drink on television. We need a public education campaign on television every day. 5 or more ingredients comes out of a packet, ultra-processed, avoid it. That's what we need. We need to dissociate it from sport, ultra-processed food and drink from sport and sporting events. We need to encourage more active travel, of course, activity, getting out and about. I haven't talked about it in detail in this, but of course it's very important. I give that guidance and advice in the book. And I think that we need to also think that, we need to be assessed as doctors as well, and dietitians, nurses as well, about our metabolic health, to help us get physically healthier, to help us mentally, and with whatever support structures are there, and also to think about our patients. I'll just finish with my final slide. I've written this book to empower people, but I hope you can go away, take some of these messages, help your people around you, your friends, your family, your community, but actually also be advocates. Make yourself an advocate. If you are convinced by the arguments, if you think this makes sense, we're all interconnected. COVID has highlighted that we're all interconnected. The food the ingredients we get are made by other people, for what we cook, the clothes we wear, using public transport, we're all interconnected, and we need to be more resilient when the next pandemic, God forbid, when that comes around. So we all need to help each other. Helping ourselves is helping each other. And to do that, we need to be able to stand up and talk about it. Harvey Milk, the gay rights activist, said, "Rights are only won by those who make their voices heard. Hope is never silent." Thank you very much.
Thank you so much. Sorry, do you just want to unshare your screen? Perfect. Thank you. That was absolutely fascinating. So much to think about there. And I know we've got quite a few questions that are in the Q&A section. So I will go straight to them and see if we can get through quite a few before we have to finish. Is the lower incidence of symptomatic COVID-19 in young children related to their vanishingly low incidence syndrome?
That it's just, we don't fully know the answer. The most likely thing is we know that the immune system with age generally tends to become less robust. It's that children, seem to have a much stronger immune response. But yeah, I'm sure that is probably a factor, but it's probably just the fact that they're just very young.
Thank you. Veganism has become a trend. What is your view in terms of a plant-based diet? Does that really provide the body with everything it needs?
Yeah, that's a very good question. So theoretically, a vegetarian diet can give you all your nutrients, and you can get enough protein. My mum didn't have enough protein. There's a big problem amongst Indian vegetarians who don't get enough protein. It's harder to get it from being vegetarian. It's easy to get it from meat, but you can do it, and you just have to choose the right foods. If you're vegan, almost certainly you need to take B12 supplements. Now, I think the problem with the vegan movement, some of the issues, is that the food industry, again, are exploiting it. So anything that does not contain animal products can essentially be marketed as being vegan. And a lot of those foods are ultra processed. Even sugar is vegan. High refined carbohydrates are vegan. So I think what we should all focus on, really, I think, I understand people's preferences and their values, and my mum was vegetarian for religious reasons, and I completely respect that, the ethical reasons for that. Is I just think we need to realize that just because it has a label of being free of something doesn't necessarily mean it's healthy.
My son is a type 1 diabetic and due to start university in 3 weeks. We practice low carb as best we can. His HbA1c is 5.7%. What can I encourage him to do to stay safe?
Wow. Okay. Well, it sounds like this person's son is actually being managed very well. So I think that we know that low carbohydrate diet's actually very effective for glucose control in type 1 diabetics. So it sounds like, from what you've told me, it sounds like you're doing everything right.
My diagnosis is fibromyalgia. Sorry if I'm saying this wrong. I may be pre-diabetic. My weight soared, although I usually make food from scratch. I'm a lifelong vegetarian. Oh, hold on. I cough from my stomach. I cough from stomach acid, and my GP says go out. I recently managed to start moving, having utilised Paul McKenna to manage pain. What can I try next? I'm desperate and worried. female and 50. 6 years ago, I was very healthy and fit. Sorry if that's a bit jumbled.
Yeah, Laura, to be honest, it's a bit difficult for me to comment on an
Yeah,
individual sort of health
sorry.
case. I mean, I would just say that if you're not, I would say seek out either a functional medicine doctor or, you know, a nutritionist or specialist dietitian.
Yeah.
Maybe someone that needs, you know, a bit more time with you, a bit more support to just go through everything. I can't really comment on an individual health case.
Of course. You mentioned the dietary guidelines, which are appalling. There is a strong incidence of anxiety in children, and a lot of it is caused by bad carbs and sugar. The psychological profession is not aligned with the link between nutrition and mental issues. And when it comes to eating disorders, most dietitians specialised in EDs have no clue about this link. Is there any change in the training of future dietitians, mental health professionals to address these issues?
So I personally, you know, I liaise with dietitians and academic dietitians, and I think there are movements going on at the top end to try and change some of the training so that dietitians are also trained in managing some of these chronic conditions. There are a few dietitians out there that are trained in prescribing low carbohydrate diets for people with type 2 diabetes, for example, but they're few and far between. This is a problem across the board, both amongst medicine and dietetics as well. So, you know, dietitians traditionally really were trained to kind of keep people well nourished in hospital. You know, they're not trained to deal with managing this chronic metabolic disease as the science has become evolved and is relatively new. And the same thing happens in medicine as well. So really people are not empowered from that perspective. But hopefully there will be changes coming along, but we need to keep pushing for
them. Do you think that chief execs will ever be held accountable as suggested by the BMA? If so, what time frame might that be?
Well, they need to be held accountable now. And in fact, I would encourage everybody that goes to, you know, if they're in hospital, if they're seeing these foods being purchased, if they're not happy with the food that their relatives are getting, they need to write to the chief executives. You know, chief executives need to respond to these letters. We need to just don't be apathetic. Don't think that your voice doesn't count. Every voice counts. Write to the chief executive, highlight your concerns, cite the BMA, cite the Academy of Medical Colleges, saying, what are they doing about it? Get a response and ask them, how can they find it acceptable to allow the sale of these foods on their premises? They need to be held accountable, absolutely.
Thank you. Why do you think things like vitamins and food are being ignored as part of the COVID-19 solution?
I don't think they're being ignored. I think one thing I didn't talk about in this is there is definitely a correlation with vitamin D deficiency and people getting worse outcomes. Vitamin D is a very essential, you know, vitamin, pro-hormone, however you want to describe it, that has so many roles in the body, including keeping immune system, you know, functioning normally. And it's also linked to many of these chronic conditions. So I would, in the book, I advise actually everybody really, certainly through the winter months, should be taking vitamin D and should know their levels. Most people are severely deficient from Asian backgrounds in this country. So I think it's lack of knowledge. I think that's what's going on. There is, again, the same issue, lack of knowledge, why it's not being discussed. If you're following a so-called varied diet of real foods, of whole or minimally processed foods, you will get almost all your nutrients. You know, with the exception of vitamin D, which you really need in terms of sunlight predominantly, you will get all your nutrients. And therefore, there isn't really a role, you know, on a population level to be prescribing multivitamins, etc. At the same time, I think some people probably take multivitamins as a substitute and think that they're just getting multivitamins from a you know, as a pill or whatever, and then eat junk food as well. And that also isn't very helpful because that isn't going to give them much protection. So it shouldn't give them the illusion of protection. Get your vitamins from food and top up if you need it. If you've had a blood test, you've got a deficiency.
Great, thank you. How can we as members of the public help this campaign?
We've all got a vote, we've all got a voice. You need to you can write to your local MP. You can ask them, what are they doing about all of this? I've given my 10 points at the end of the book. So, you know, feel free to cite those, add in your own and ask them, what are they doing? You know, speak to your doctors. Every doctor learns from their patient. Doctors are very open to this. If the patient comes to them with information, doctors want to listen and learn. Speak to your doctor, your GP, get your metabolic health markers checked, educate your doctor. You know, I learn something new from every single patient that I see. So I think that just have some, be positive about it, but be proactive as well.
Great, thank you. And just finally, what can healthcare professionals like myself do to start the changes within an NHS trust? I've been eating low carb for well over 12 months and it's upsetting.
Oh, that's sad. Okay. Well, I think that you can just keep trying. Don't give up. I think, you know, you need to spread the message. Get, you know, give people the book. I mean, that might be one way for them to start. You know, give people the book to read. Set up meetings with you know, the people that have some power within the hospital that can institute changes so that we can start, for example, improving hospital food. I think that's all we can do at the moment. You know, just don't lose hope. Just make sure, but realize that it can be a little bit of an uphill battle, but just keep banging away. You know, ultimately, we're all affected by this. People realize something's wrong, and people are looking for solutions. We just need to give them the right ones.
Thank you. I think we're going to have to stop there, but it's just been so interesting. Thank you. And please do obviously look up the book, everybody, and hopefully it will give you some inspiration to get fit and healthy. Stay healthy, everybody. Thank you very much for joining us. Thank you once again, Dr. Malhotra. Good luck with the book, which I understand is a bestseller already. And we will see you another time at a How To Academy event. Thank you. Good night.